Welcome back to Navigating Cancer. I'm Dr. Joey Bennett along with Wendy Hall. We want to thank you for tuning in to today's show, and we're talking about the importance of nutrition. As we finished the last segment, we were talking about the impact of poor nutrition and a few more things that I want to touch on. One, it increases your risk of having a complication after surgery. You tend to be kind of apathetic and depressed about it, and that can just feed on itself. People complain of being tired, sleepy, and weak. And what's startling is about 20% of people who have cancer literally die from the effects of malnutrition rather than the cancer itself. So it's very important that we try to jump in on this and intervene if you're losing weight and having trouble as fast as we can, because we know that early intervention improves the outcome. And as I said earlier, we watch your weight carefully. We want to know what you're eating, and we do not hesitate to refer someone to a dietitian if that is necessary, because if we can get the help of a dietitian to structure a diet for you and things to eat, we really want to jump on it as fast as we can. Other things that we try to do when we're managing malnutrition is that if you've got some side effect that's keeping you from taking in calories, let's work on correcting that. If you're depressed, let's treat the depression. If your mouth is bothering you, there are things we can do to help with the discomfort of the mouth. We may need to modify the diet, and sometimes we'll consider supplements to your diet, and we'll cover some of those in just a few minutes. And this includes some of the artificial nutrition type things if they're appropriate. You know, if you can eat foods on your own, and if you can cook the things that you like and eat the things that you like for your calories, that's absolutely what we all want to do. But in our practice, we know that very often we do have to give patients supplements. And there are several different supplements on the market. Here's a few of them. Ensure makes a product which comes in a juice form and also kind of a milk form. There's a product called N-Shake. There's another product called Carnation VHF. And you can see that these little 12-ounce cans contain anywhere from 300 to 560, even 600 calories in just a simple little 12-ounce can. So, as I spoke about earlier, if it's calories we're looking for, you can get those in. But the beauty of the Ensures and the Susticals and things of this nature that are out there is that they also have vitamins, minerals in them, which kind of help people as well. If you get to a point to where that doesn't work, if you can't take things in by your mouth, then we have other alternatives, and we can look at various routes of getting calories into you. An NG tube is a tube that slides through the nose down into the stomach. A PEG tube is a tube that actually pierces directly through the wall of the stomach and into the stomach, so that you can now literally with a syringe squirt in these nutritional supplements that will help you. And we have lots of different ones. Very often we will deal with Brashear's Pharmacy on patients when we're having to do these types of feedings, because there's so many different supplements out there. It's nice to have Pam Kennedy kind of help us with deciding which one is best for each individual patient, because one person may need more protein than another. One person may have a kidney problem and they don't want to be overloaded with protein, so we really try to consult with those people. And then the other thing is having you talk to them a lot of times, because sometimes it's the depression, anxiety, and just feeling blah, and I think that that's where you come in critically too, is to help them with that.
Right, and not be able to get to the grocery or whatever it is on a timely fashion.
Right, and I mean sometimes just trying to find somebody to help them get to a grocery store and maybe
or
realize...
get their groceries for them.
Exactly, I mean lots of things that can be done. Another extreme of this is that you can go to what's called parenteral nutrition, and this is basically giving it through IVs. And we really reserve this for people who just can't get any nutrition otherwise. The slide said if the gut works, you want to use it. It's so much simpler, because if you're going to go beyond this, now you're going to have to put in an IV, and it tends to be what we call a central line. It's got to be a really big IV that can stay in there for a long time. You can get calories and fats and proteins and everything through these IVs, but these are typically used for people who are really critically ill and used for just a short time period to try to get them through that illness so that they can slowly work back to taking things in by their mouth, because that's absolutely the way you want to do it. Sometimes, though, people's guts just don't absorb things. The intestinal tract is not absorbing the way it's supposed to, so you may have to go directly into the bloodstream with these nutritional types of things. There are also some alternative diets and some supplements that we can look at. We can get help for patients who are needing assistance in getting their groceries and cooking. You want to kind of cut out things that aren't really good for you and don't provide you with a lot of calories. I mean, you know, if you're sitting there eating rice cakes, it may fill you up, but there's not a lot of calories that come from it. If you're sitting there eating a lot of popcorn, there's not a lot of calories that come from it. So if you're going to spend time eating things that are going to give you the calories and the nutrition. The biggest thing, too, though, is realize that there is no quick fix to this. It takes a lot of cooperation. And again, like I said earlier in the show, it's not necessarily about you gaining weight, it's about you maintaining your weight. Because if you do that, we're going to be able to improve the quality of your life for you. Your family members are going to feel better because they're not seeing you lose weight. And we're going to be very proactive on this. I mean, we're going to pester you to death, again, because if you start losing weight, the faster we jump into helping you with this, the better off you're going to be. And sometimes we will carry it to the point of getting a dietitian involved. And some of the dietitians in our area really do understand very well the specific needs that cancer patients have when it comes to nutrition. And we're going to take a food-first approach. We don't want to move to supplements. We don't want to move to IVs. We don't want to move to putting tubes in unless we just absolutely have to, because the easiest, safest, and most pleasurable way to get a calorie in is by mouth so that you can taste it and enjoy it. And sometimes we will recommend some supplements for people. I mean, if we're sitting here and we realize that they're eating a little bit but they need a few more calories to kind of help with things, we may truly recommend that you drink like 1 can of Ensure or Boost per day. So the biggest thing, again, and we keep hitting on this over and over again, is communication. And I think it's so important that in our practice, I see the patients, our nurses see the patients, you see the patients, our therapists see the patients, because sometimes patients will say something to one of us and not the other, and it's the communication that we have in the office that lets us jump on these things early.
That's right. And family members, please feel free to talk to Dr. Bennett or Dr. Brand about these issues rather than bullying your loved one, because a lot of times that turns them off and it doesn't work.
It does, and I mean, if you're a caregiver, spouse or so, and you're seeing these things, it can sometimes be hard on you, and you don't want to pressure them too much to do these things. Maybe come to us and let us pressure them.
That's right.
Okay. Thank you for watching the show today. Please go to our website at www.rboi.com, and we hope you'll tune in for the next episode of Navigating Cancer.